The way to diagnose this disease is a little bit tricky because remember, it's something that is a natural system. We have it there all the time. So you have to have a patient who has had either a blood clot or has had multiple miscarriages and then has had some of these labs positive. So, for instance, though, if you have a patient that is on their way to the lab to get their blood drawn and they even stub their toe or they have a small fall, suddenly their clotting factors are activated. And when they go to get this blood work done, it'll show that they have a clotting problem when they really don't, which is why you need to repeat it in about 12 weeks. And about a fourth of these patients have what's called a false positive lab test, meaning that the lab test is there, it's abnormal, but it's not causing disease, such as in those patients who are pregnant, who are on certain medications, and have certain infections. And then once the diagnosis is made, then this disease is divided into primary or secondary causes. Primary meaning it's its very own disease on its own, nothing is causing it or nothing is irritating it. And secondary meaning that there is something else that's chronically irritating the immune system, and the immune system now then creates this disease, such as in autoimmune diseases like lupus, but certain medications, infections, and certain cancers. To make it even more fun, there's a lab test called the lupus anticoagulant. Even though this disease is not lupus, and even though this disease does not thin out the blood, it actually makes the blood more thick. The